Between doing a fat transfer and a liquid BBL, which one is better? Okay, we've come back with part 2 of we're still talking about Elena, right? Elena Jessica is, of course, a Nigerian socialite that just had her surgery with gynoshua that resulted into complications, and later on, she passed. Yeah, she died. Before you blame gynoshua aesthetics, plastic surgery, it's a clinic that offers these cosmetic surgeries back in Nigeria. I do not know them. Yeah, it's not, quote me right, I'm not supporting, I'm not on that side. I'm not conceding with them. No. I just want to let you know the general practice, the basic things that we do before we offer you these surgeries. Yeah, I'm not saying that whatever happened was right. Please quote me right. So I want you to get me right. Mumfunide ku side into full. It's not that I'm supporting them. It's not that I have anything that is bad on to the girl that passed on. No. I do not know. Actually, this is general information that is maybe going to help you as a person that is watching me, or maybe if it doesn't help you, it's going to help someone that is really in need of this kind of surgeries. Yeah. So if we to talk about the side effects, the risks, or the complications, remember I told you in the first video that whichever surgery that you'll ever want to do to yourself, it carries risks, it carries side effects, it carries complications. Now, these are the known complications, known side effects, known risks of a BBL. For those that do not know, it's a Brazilian butt lift. For these complications, we have the early or immediate complications, and we have what we call late complications. That means these are the complications that will happen later on. You're unable to see them immediately. You're unable to see them as soon as you finish the procedure. Yeah, you receive them later on. So let me start with the early or immediate complications. In these complications, we have what we call bleeding. You know, when we are doing the surgery, the mere fact that we're going to work around healthy tissues that are supplied with blood, so we expect the bleeding. Where does the technique help you from, or having professional doctors do your surgery help you from? They're going to know which side to touch and where not to touch. Yes, they're going to know what to do next when something has happened. That's where really you're going to professionals who help you from. So when we are doing liposuction, of course, bleeding, we can't stop that from happening, but we try our level best to really prevent ourselves from touching the major vessels. Yes. So the second one, we have infection. We have microorganisms all over. It's not that we do not use aseptic techniques. We use them. You've seen very many videos of us putting on those surgical gowns, the surgical gloves, having the procedures done in a sterile environment. We clean with disinfectants when we're going to do the surgery, but we cannot really clear them off 100%. What do? We always try to give antibiotics to really clear even the little ones or the few that would have crossed over to the working site or the incision sites. The other thing, we have a seroma. Seroma means fluid collects. Remember, as we're going to put in as we try to release and create space, put in fat, so fluid might accumulate or fluid might form in the area that we worked on. That's why we offer compression garments immediately after the surgery has been done. As a compensatory mechanism, when the body detects that there is space in between, however much we put fat, but yeah, there will be that space. So if the body detects that space, it means it will start withdrawing fluid from the surrounding tissues in order to fill up the space that it would have detected. And another thing, we have Fat embolism, that is the worst one amongst all. A fat is put in a vessel, and that vessel carries that fat to another area, blocking the blood supply. It can carry to the lungs, causing pulmonary embolism. You get, yeah. So fat emboli or fat embolism is also a known complication that can happen. It's not a must that it will happen, but it's known that it can happen with a BBL, and it's a most serious complication in all the infections you can get. There you can get fat embolism. Don't prefer yourself to get it. Yes, another one we have anesthesia related complications. Yeah, difficult in aspiration, difficult in breathing, all those things. So breathing problems during the surgery, they're also known what? They're also known complications. Then we have pain and swelling. Of course, immediately after the surgery, you'll feel some pain, but we try to control it with painkillers. During the surgery, we do it under general anesthesia in order for us to prevent pain from happening. Now, let's talk about the late complications. The late complications in these ones, we have fat necrosis. Fat necrosis, mganda wange. Necrosis means death. That means the fat that would have transferred to the bums, it really actually dies off. When it dies off, the body will start excluding it out of your body. If it helps you and it just stays in there and it doesn't take, well and good. But if the body rejects it and it starts pushing it outside, that means you create some small pores on the bums where the fat will start finding its way out. It's also a serious complication, fat necrosis. So your fat that would have put in the gluteus will start dying off. Then we have buttock asymmetry. That means buttock A might come out so well compared to buttock B. Bum A might be perfect compared to bum B. Another one, we have contour deformities. Contour deformities, that means irregular shape or uneven shape due to unequal fat distribution. Yes, as well. However much you put in fat, the distribution is not our part to play. It's your body's role to play. Then another thing that maybe you should be aware of, skin necrosis. The skin around the bum area might die off simply because of low blood supply. Then nerve injury, we might injure the nerves when we are working, so it's also a known effect. Then we have fat resorption. Fat resorption, it basically means the body starts reabsorbing the fat that we put in. So in doing this, it might actually take the ones that we found in the very first place. Does that make sense? Like, we give you fat in order to grow the gluteus, to make it appear bigger, but then in this case, your body will reabsorb the fat that we've put in. It will eat up the fat we've put in. So in taking up this fat, even that you had in the very first place, so leaving you with a smaller bum compared to the one that you had previously. Then we have what we call scarring. The scarring part of it, you might end up having scars from the procedure, from the BBL, a procedure that you had to have a bigger bum. You might end up having scars around. You get what I mean? The scars, but the kind of scars that you're going to have are the scars that are going to be at the entry points. These scars are not going to be so deep, or the injection holes, or no. They're going to be around the entry points. That means the entry points that you had when you were liposuctioning, when you were taking out fat, then the entry points that you had when you were transferring fat. So that means at the back, at the tummy, and at the bums, you'll have scars around the entry points. Amongst all the complications that I've given you, the most important and serious complication that you shouldn't prefer yourself to get, amongst all that I've listed down, you shouldn't prefer yourself to get a fat embolism. during, a fat can easily cross, or it can be put into a vessel, and this vessel is transferred to a place where it's not supposed to be, and it blocks blood supply. If it is put into the lungs, it will give you what we call a pulmonary embolism. Yes. So complications that I've given you, the only serious complication is a fat embolism. You shouldn't pray, and you shouldn't actually think of you getting one. Yeah. So when you're going to have your surgery, these are the things that you should put at the back of your mind. They can happen, but it's not a must that every complication that I've listed for you down, it will happen. No. However, the most important one, or the most fatal one, this can even lead to death. It's a fat embolism. I'm not saying it's what took Jessica Elena. I'm only saying it's something that is known that it can happen. Yeah. So these things are on. These things we give them to you, but only that you come in with excitement. You never read. You never understand. You never really get to think of these things that they can happen. Yeah. So yeah, basically, before you blame gynosure, before you blame the patient, before you start criticizing before you criticize the other, get to know that these are things that can happen at any time, and when they happen, some have solutions, whereas others do not have solutions. So it is fatal and it is life-threatening. For now, I sign out. Yes. In the next video, maybe I will tell you between doing a fat transfer and a liquid BBL, which one is better. That is an interaction that we should have, or that is a conversation that we should hold, but not for today. Maybe some other time. Sign out for now. May Elena's soul rest in eternal peace, and we pray that the family also gets to go through this. It's not so easy. I sign out.